Jai Shri Krishna. A very warm welcome to the day 30 of my YouTube channel, Dental Tips. Today's topic of discussion, today we are going to discuss about deciduous mandibular first molar. Now this deciduous mandibular first molar, it is replaced by permanent first premolar in the permanent dentition, and we have discussed in the previous videos that deciduous teeth, they have no premolars. Now, we are going to study the various aspects of this deciduous mandibular first molar. Coronal aspect, radicular aspect and pulpal aspect. First coming to the crown portion, coronal aspect. Buccal aspect, that is that portion of the tooth facing towards the cheeks. So, the buccal aspect, it has mesiobuccal cusp and a distobuccal cusp. Now, this mesiobuccal cusp is larger than a distobuccal cusp, which is smaller and rounded. And these two cusps, mesiobuccal and distobuccal cusp, they are separated by a buccal depression. Then after that we come to the lingual aspect, that is that aspect of the tooth which faces the tongue. And the lingual aspect has a longer, larger, sharper, pointed mesiolingual cusp and distolingual cusp. Distolingual cusp is not that longer, larger, sharper and pointed than the mesiolingual cusp. And these mesiolingual and distolingual cusps, they are separated by a lingual groove. Now we come to the distal aspect. Distal aspect, that is that portion of the tooth that is away from the midline of the face. And distal aspect is, it's uniformly convex. And the mesial aspect, it is less convex as compared to the distal aspect. Now we come to the occlusal aspect. Occlusal aspect, it is rhomboid in shape. And we see these four cusps: mesiobuccal, mesiolingual, distobuccal and distolingual. And in the occlusal aspect, there are certain pits. Like there is a central pit and it is very large and it is very deep. Then there is a mesial pit. Mesial pit is located mesial to the this mesiolingual and mesiobuccal cusp, and that mesial pit, it is medium sized. And then we have a distal pit. Distal pit is distal to the distobuccal and distolingual cusp, and distal pit is very much shallow. So after this, we are going to discuss about the roots. There are two roots, mesial root and distal root. Now, root canals or pulp canals, there are three: mesiobuccal, mesiolingual and one distal root canal. So, three root canals or pulp canals. And pulp chamber. Pulp chamber is in the coronal portion of the tooth. Pulp chamber has four pulp horns: mesiobuccal, distobuccal, mesiolingual and distolingual. And with this I end my today's topic. Thank you many folks for watching my YouTube channel. Jai Shri Krishna.